Welcome to this short overview of the impact of dry eye and its treatment. This bite-sized seminar is part 1 of 4 introducing dry eye and its management, brought to you by the Alcon Experience Academy. My name is Jim Dixon from Alcon Professional Affairs UK and Ireland. The subsequent presentations will cover dry eye clinics or part of your normal routine, clinical diagnosis, what and how you do this, management and commercial opportunity. The recently published TFOS DEWSII report has given us insight into how dry eye disease impacts the quality of life of a sufferer and the prevalence of the disease. It also gives us a clear, structured diagnostic pathway and management plan. Let's look at the impact on patient quality of life first. This multifactorial disease of the ocular surface can result in the following symptoms: discomfort, burning, dryness, photophobia, foreign body sensation, hyperosmolarity of the tear film, sensitivity to wind and air conditioning, tear film instability, and potential damage to the ocular surface, blurred, fluctuating vision, and inflammation of the ocular surface. I mentioned that this is a multifactorial disease, and an example of influencing factors are working with a computer, dry environments, aging, menopause, use of certain medications, and eye surgery. Dry eye disease affects hundreds of millions of people throughout the world and is one of the most frequent causes of patient visits to eye care practitioners. The impact of dry eye on quality of life is through pain and irritative symptoms, effect on ocular and general health and well-being, general quality of life, effect on perception of visual function, vision-related quality of life, and impact on visual performance. Patients report that it can impact on nighttime driving, watching TV, computer work and reading, and have an overall impact on their quality of life. Depression, anxiety and stress is also more prevalent in those suffering from dry eye disease. This impact on patient day-to-day life is comparable to that of moderate to severe angina. We will consider the diagnostics which, combined with the recognised methodology and classification in other presentations in this series, but let's look at some of the common challenges to the patient and the eye care practitioner in managing a treatment plan. It is imperative that after diagnosis that the eye care practitioner takes time to fully explain the chronic nature of the condition. Explore with the patient their understanding of chronic. Check their understanding of compliance. This really highlights the need for improved communication and an opportunity to give written instructions on each type of dry eye. Ian Davies has produced a series of education pieces on the importance of good communication, which can be found via the Optician magazine. And it is worth remembering that, in his words, communication skills are a requirement for General Optical Council registration in the United Kingdom. Developing them not only improves patient satisfaction, but also compliance and treatment outcomes, as well as reducing the risk of litigation. It is also important for the eye care practitioner to appreciate that dry eye disease is a vicious, self-perpetuating inflammatory cycle, where the body's own natural defence mechanisms, in the form of antigen-presenting cells, travel to the lymph nodes from the cornea and activate T helper cells. This occurs when hyperosmolarity damages the cornea. These T helper cells travel back from the lymph nodes to the inflamed area of cornea, bringing enzymes to fight infection and causing further damage. This is the vicious circle of dry eye disease. Only by proper explanation and the insistence of compliance will the disease be managed to optimum levels. If you have any further questions or would like more information, please contact your Alcon Business Development Manager or a member of our Customer Services team. In part 2 of our series, Introducing Dry Eye, brought to you by the Alcon Experience Academy, we will be looking at clinical diagnosis, what and how you do this.